We're all feeling the extreme heat this morning, but the scorching temperature is more than just uncomfortable. It can also be dangerous to our health.
There's a direct association between high heat and visits to the emergency room. When the heat index rises above 91, you need to take precautions to keep cool. We asked Dr. Jared Dukowski to give us advice on how to stay safe.
He's Associate Medical Director of the Emergency Department at Hackensack University Medical Center. Good morning, Doctor. Thanks so much for joining us.
Good morning. It's a pleasure to be here. Thank you for having me.
So tell us, how does extreme heat affect the body?
So extreme heat can affect the body in multiple ways, ranging from things that are a little bit more minor to things that are a little bit more severe. When temperatures hit those extreme temperatures that we've been seeing this week, your body tries to respond by regulating its temperature. Unfortunately, when that temperature gets a little bit too high, your body loses that ability to regulate its own internal temperature. And so you start to feel symptoms that can lead to dangerous circumstances. This comes in all sorts of flavors, from more minor things like a little swelling in the limbs, to feeling a little dizzy, to something a little bit more dangerous like heat exhaustion or heat stroke.
Doctor, what's the difference between heat exhaustion and heat stroke?
So heat exhaustion are some of the first symptoms or signs that you're going to experience when temperatures reach extremes. It's a warning that your body is having trouble regulating with this temperature. Heat exhaustion might present with some more minor symptoms such as headaches, a mild confusion or dizziness, loss of appetite, extreme thirst, or cramping in the arms, the legs, or both. When temperatures in your body hit more extreme measures, then you'll start to experience heat stroke, and that's where things can get very dangerous. In heat stroke, your body has actually lost the ability to regulate its own internal temperature, and you can start to experience some more dangerous signs. At that point, someone might be very confused, not acting themselves, and the temperature in your body can actually reach extreme temperatures on its own. We're talking more than your typical fever temperatures of 104 plus.
And doctor, who is the most at risk in these high temperatures?
So there are a few groups of people that are most at risk, and I would recommend for anyone within these demographics that you take extra precautions this week, or really in any extreme temperatures, to make sure you're staying healthy. These would include older adults, particularly those above 65, especially if you're someone that lives alone who doesn't have someone to check in on them. Anyone with medical conditions such as diabetes, any kidney disease. If you're taking certain medications, you have to be careful in the heat. Pregnant or breastfeeding mothers, as well as infants and young children, also those that are overweight.
What precautions should we take during this extreme heat?
So there's many precautions that I would recommend people take in order to help regulate their own body temperature so that they don't reach or don't experience signs of heat exhaustion or heat stroke. Drink plenty of water. It's important to stay hydrated. And if you're someone whose daily water intake is limited, speak to a medical professional about how much you can drink. You want to keep yourself cool. If this involves using wet towels or just making sure you're staying nice and moist through the extreme heat, it's a good idea. Spend as much time as you can in cooled, air-conditioned places, whether this is a home, apartment, mall, movie theater, and try to block out the sun or stay out of the direct sun, whether this is closing the curtains or staying in the shade.
Dr. Jared Dukowski, thanks so much for joining us, Associate Emergency Department Director at Hackensack University Medical Center. Good to have you with us this morning.
Thank you for having me.